afternoon, everybody, and welcome back, or welcome to people who are here for the first time. Today, we are looking at compassion-focused therapy. The speaker is Dr. William Davies, Head of Applied Clinical Psychology at the APT, and I am Amy George, Deputy Director here at the APT. So, speaker is Dr. William Davies. He is a consultant psychologist and Head of Applied Clinical Psychology at the APT. Post-qualification courses written by him have been studied by over 125,000 mental health professionals, meaning that his input has influenced interventions with literally millions of people. So, Will, it is all yours.
Lovely, thanks, Ames. I'm going to try and share my screen. That's going to stop your screen sharing, it says, but you're resigned to that, aren't you?
Yeah, don't worry, I'm happy.
So there we are. That should be right now.
Yeah, perfect.
Great, there we go. So I just put our pictures out of the way. And yes, welcome everybody, and lovely to see people coming from all over the place, even Suffolk, which I gather is nice and sunny, which is good to hear because it's absolutely bucketing down right here. So it's compassion-focused therapy, and I'm delighted to see so many people have signed up. I don't know how many people are going to be able to actually check in because a lot of people are back to work now, but I think we've had as many people sign up for this session as probably any session we've ever done. So that is lovely to see because it is a very important therapy actually, and we'll have a look at it straight away. By the way, if you want the APT accredited training, the 3-day training and so on, see the website. But in the meantime, I'm going to try and cover as much as we possibly can within the 45 minutes or so we take. Here's the agenda. What is compassion? What is CFT? Multi-minds we'll come on to. The 3 affect regulation systems, the 3 systems that regulate our emotions. Accepting and adapting to things, part 1 accepting and part 2 adapting. Then I hope we're going to have time to get as far as affiliation, warmth and affection, and soothing and balancing our emotions, sandwiching threat and achievement. I've crammed in as many slides as I can, and there aren't really many questions built in. So if you're going to have a nice interaction, which I think is lovely, you're going to have to say things and ask things of Amy. And Amy keeps an eye on all that, and she interrupts nicely whenever she feels like. So let's move on. First section, what is compassion and CFT? Best definition of compassion I found is in the Penguin English Dictionary, which is always good. The empathic consciousness of others' distress, together with a desire to alleviate it. It's interesting, there's all sorts of definitions, but I think that says pretty much everything about it. The consciousness of, or the empathic consciousness of others' distress, together with a desire to alleviate it. Very nice. Now, in CFT, in compassion-focused therapy, we are, of course, exhibiting compassion, but we do that, whatever therapy we're applying. So even more so, what we're helping people to develop is compassion for themselves, mainly, compassion for other people, largely because that helps people feel compassion for themselves, and also the ability to be sensitive to compassion from others, because some people are the subject of compassion, but they simply don't sense it, which is a great shame. So it's those 3 goals in compassion-focused therapy, number 1 of which is, if you like, the main one. Now, this is an important acknowledgement because Paul Gilbert, is really the power behind CFT. And Gilbert, Neff, and Cosolino are the 3 big names in the area, certainly. So Paul Gilbert's evolutionary and attachment-rooted model has taken hold most of the 3. And the presentation that I put together now relies heavily on his book, relies on my clinical experience and work from other places and so on. But really, most heavily, it's on his book, which is a picture there. He's written lots of things on CFT, but this is probably the best. And if you want a single access to CFT, this is probably the one. But in the meantime, I'm going to tell you as much as I can about it. Now, so what we've got is a string really of important observations from CFT, and this is the first one. This is what he said. Over 20 years ago, I found that alternative thoughts have different impact if said to oneself aggressively than if they are said slowly and with kindness and warmth. It was the same with exposure or homework. The way they are done is really important. Bullying and forcing oneself versus encouraging and being kind to oneself is so important, and compared with what is done. So my first steps in CFT was simply trying to encourage clients to imagine a warm, kind voice offering them the alternatives, or working with them in their behavioral tasks. So the first step was to do CBT with a compassion focus, a kindness. And that's exactly what Paul did years ago. Paul was a tutor with the APT, and he was originally into CBT, still is, I believe, and it went from there exactly as he describes. So we are already at the end of our first of our sections. What have we covered? The definition of compassion. Paul's highlight to the importance of the idea that we can be compassionate towards oneself, ourselves. The idea that potentially helpful thoughts work best if they're said with kindness and warmth rather than with hectoring and bullying. And the idea of Gilbert's evolutionary and attachment-rooted model that has taken hold. And his book, the 2010 book, there it is. Okay, it's early days, Ames, but any contributions?
None, no questions at the moment, but lots of hellos, which is nice. Hello, everybody. But also, remember to pop all panelists and attendees if you want everyone to see your lovely comments so that everyone can see them.
Great. Okay, on to section 2, which is one of the first of the meaty sections. It's termed multi-minds, in other words, multiple minds, several minds. Whenever the brain manages to integrate our multiple minds into anything like a coherent and stable personality, it is doing an amazing job because there are so many multiple minds. I want to tell you a story about how easy it is or how difficult it is to show compassion. And it's a bit of a shocking story, so I don't mean to shock, but it brings us, I suppose, to earth a little bit compared with just talking about CFT. The question is, how easy is it for us to show compassion? And of course, I would say, and I expect you would also say, easy. You know, we are naturally in our job, we show compassion. But I want to tell you a story about a family, a mother and father, who were very proud of their daughter, who had got to university. She was an only daughter. She'd got to university and she was going off to university regularly now. And they're so proud they bought her a brand new car. They were a bit protective of her, so they didn't want her to be riding around in an old beaten up car. They wanted her to have a nice brand new car that wouldn't break down. And just in case, they signed her up to one of the larger breakdown services in case she did break down. Well, lo and behold, the nice brand new car did break down on the way to university, and she called the breakdown service out. And the breakdown man arrived, and instead of repairing her car, he raped her and murdered her. Now that is easy, isn't it, to show compassion for the victim of that offence and also her family. Very, very easy, I think. But I was working in prison at the time. I spent 10 years as a prison psychologist, and the person I was seeing was not the family, but the offender. And how easy do you think it was to show compassion for him? Not very easy, I have to say. And indeed, if you talk about multi-minds, there's a bit of me that thought, well, I'm not sure I want to try to show compassion for him. And how easy do you think it would be to teach him to show compassion for himself? Do you think he thought he was a pretty good guy? Not at all. So it is sometimes much easier to show compassion than other times. And there are people for whom it's easier to teach them compassion and other people for whom it's very difficult to teach compassion to. So there is a whole span. And as I say, I don't mean to sort of shock, but on the other hand, it's interesting to talk about real patients rather than necessarily just the just the academic side of it. But what Paul Gilbert says, is that although we like to view ourselves, think of ourselves as integrated personalities, in fact, each of us is made up of a variety of different selves. We may recognize in ourselves the bullying self, the perfectionist self, the sexual self, the forgiving self, the vengeful self. There's a myriad. It goes on and on. And in therapy, the patient may learn to recognize these different selves and talk about them.
Amanda's asking that sometimes she finds it a lot easier to show compassion for others than herself. Is that common? Oh,
absolutely, yes. And that is the problem we have to solve in therapy, that the patient's exactly the same. I'm not sure there's even a connection between how much compassion you show for yourself and how much you show for other people. But this is the problem. Many people in therapy don't show compassion for themselves, even if they do for others.
And what helped you to have compassion for that man that you were talking about?
I suppose it's always an awareness that you're doing a job. It's what I was being paid to do by the taxpayer, and it is just one of those things you have to focus on. And in case that sounds very virtue-seeking, I'm not meaning to, because it's simply not always possible. And I did meet people, really very bad people who I just found very, very difficult. But you just try your best, I think. I haven't got a better answer than that.
And a nice tricky one from Hillary here. Please, can you explain the difference between compassion and empathy?
Oh, right. Well, empathy is to do with almost imagining what it's like being in the other person's mind. Imagining what it's like being in the other person's mind. Doesn't mean you have any sort of sympathy or fellow feeling or well-being towards them. You can imagine what it's like being in their mind without wishing them well at all. In compassion, you also wish them well.
And Marie O'Neill suggests that compassion is, she thinks of compassion as empathy plus action.
Yeah, oh, right, okay, yes. That's a nice way, isn't it? Yeah. Okay, so we have different areas of the brain competing with each other, sometimes one area gaining dominance, sometimes another. So it's no wonder that people will describe themselves as tormented or not knowing which way to turn and so on. There are times when we have different areas of the brain at war with each other. That's strong words, but it is really how it is. So it's only reasonable we treat ourselves with a degree of compassion and understanding at those times. We're having a bad time, so we kind of deserve to treat ourselves with compassion and understanding. So we are compassionate about our minds. And part of our job in CFT is to help patients realize how it is that our brains often manage to balance all the competing forces into a stable existence. This engenders a feeling of compassion and supportiveness towards our brains, in other words, towards ourselves. Our brains and ourselves are one and the same thing. And there's a lovely slogan that is used, and it's this: it's no wonder we sometimes fall apart. What is amazing is that we so often manage to keep it all together. And that's a nice slogan to use, I think. It's kind of reassuring for people that that's how it is, Now, I was just sort of playing around, and I was thinking, well, supposing we were to do an exercise where I invite you to go into randomly allocated breakout rooms of about 5 people. You know the wonders of Zoom. If we were to switch over to meeting mode instead of webinar mode, we could all go into randomly allocated breakout rooms, about 5 people in each. When we were there, you could enjoy a conversation by microphone about the concept of multi-minds, perhaps sharing an example of where your different selves have been in competition with each other, possibly even how you managed to reconcile them. And once in your room, you might also like to appoint a spokesperson who will feed back to the large group. There's between 400 and 500 of us at the moment. Feed back to the large group what you thought. Okay. If you had that kind of exercise, I'm guessing that your multi-minds might suddenly appear. Your cautious mind might say, I don't want to get involved in this kind of stuff. I'm going to make a fool of myself, show myself up. I'm closing down right now. Your ambitious mind might say, this is a good chance to show what I'm capable of. I'll make sure I say what I think. If you're a parent, your caring mind might say, my little one wasn't at all well when we went to school this morning. I really want to be able to focus on them and get them if they need bringing home and look after them. And you might even have minds that you may not want to admit to. For example, you might have a sexual mind that says, I hope I'm in a room with someone attractive, might be my chance to impress them, and so on. So there's all sorts of multi-minds might appear. Just by reassurance, I don't think it's possible for us to switch from webinar mode to meeting mode, but so we're not going to do that. So it's all right. It's not going to happen, but it's just an example of what can happen as things take place. Other examples: politicians who also turn out to have a sexual self. We don't really want to hear about that, but pretty much every day we have some politician who has shown to have a sexual side as well. Sports personalities who turn out to be the super perfect role models we would like them to be. And even therapists who occasionally find that a patient is attractive. And if you talk to colleagues, that routinely happens. By the way, it's important to, just for the record, it's inevitable that therapists find patients sometimes attractive. That's the way of the world. But of course, it's not any excuse for actually acting on that feeling. Yeah. And just one last example of the multi-minds. I don't know whether anybody remembers. You will remember if you saw it, I think. We have a world record holding marathon runner lady who was running a marathon, and she had a sudden urge to go to the toilet. So, and of course the cameras were on her because she was the world record holder and they're faithfully tracking what she was doing, and they followed her into wherever she went, and she just sat down on the side of the road and went to the toilet. And of course, half of the brain says, it feels tremendous compassionate feeling. You feel sorry for them, don't you? Sorry for her, compassionate type feelings. But there's another part of the brain, isn't there, which is a little bit sort of shocked or something. It's that not a compassionate feeling particularly, really sort of shocked. So all the while, there's different parts of the brain firing up in different ways. Okay, so part of our job in CFT is to realize how it is that our brains often manage to balance all the competing forces into a stable existence. By the way, it's particularly interesting when I'm reading out these slides. The top right-hand side of the slide is always covered up by our pictures, aims. So I have to make up what might be there. So if it's more interesting than what's there, I'm sorry. This helps people feel compassion and supportiveness towards their brains, in other words, themselves. And it's a lovely slogan. It's no wonder we sometimes fall apart. What is amazing is that we sometimes manage to keep it all together. So,
you triggered a lot of people's scared brains during that exercise.
Well, it is strange, isn't it? It's even though I guess people know I'm sort of kidding, it does do that, doesn't it?
I hope you're all okay again. He won't do that again, I promise.
Yes, that's true. All done? All done. Okay. Accepting and adapting, part 1. We'll have a part 2 eventually. Part 1 is acceptance. Now, the dialectic of accepting distress, but also doing what we can to lessen it, it's a familiar one if you're familiar with DBT. And we have exactly the same thing in CFT. Another really nice slogan, it's not our fault that we've got tricky brains. We can say that routinely. It's not our fault that we've got tricky brains. That's Paul Gilbert's slogan. He advocates emphasizing to clients that we are born with tricky brains. Old brain and new brain interacting with each other, sometimes easily, sometimes not. And he says, and I absolutely agree, that this is very de-shaming. Clients realize that the way they are isn't their fault. Doesn't let us out of having to do something about it, though, which is the difference. So we can explain to clients that our brains didn't evolve for happiness, but for survival and reproduction. So sometimes we need to learn how to accept, tolerate, and work with difficult emotions or low moods. These things, difficult emotions and low moods, they're not evidence of something wrong with us, but they're quite normal responses to things in our lives. I think that's a really important aspect of CFT. The idea that we are designed not to be happy, that's just a man-made concept, happiness. No, we're just here to survive and reproduce. So there we go. Very nice bit. Okay. I'll keep going until you butter your names.
No, we're all happy here.
Okay. Let's go on to this section then. The 3 systems for regulating our emotions. Okay.
Just one thing. Is compassion the same as loving kindness?
Compassion the same as loving kindness. Loving kindness. Loving kindness. Yes, it's pretty good. It's pretty good overlap, isn't it? I think the bit that loving kindness misses out is probably the empathy bit. And in compassion, I think you do have a feeling. You can imagine what it's like being in the other person's mind. Loving kindness, I think you can simply deliver loving kindness if you're a very special person without any without any conditions. You don't need to understand what's in the other person's mind.
Super. A few people have asked that, so it must be a good concept.
Yeah, it's a good overlap. Yeah, very good overlap. So let's have a look at the 3 systems in regulating our emotions. The first system is designed for seeking out good things, achieving things, and activating stuff. The second system is looking for threats and is therefore focused on protection and safety. And the third system is affiliative focused, so it's to do with contentment, safety, and being connected to other people. 3 systems. So let's have a look how they fit together. Now, this is a diagram that I put together with Mark Betts, but it's based on the ideas of Paul Gilbert, and it does illustrate them very nicely, I think. And here you've got the 3 systems in perfect balance. Now, this is like a diagram. It's a bit like the London Tube map. It's not a very good map, but it's a diagram of the brain. And the red bits are where the emotions, you might reasonably say the emotions are mainly coming from, limbic system and the cerebellum. Limbic system, really. And what we've done, we've blown it up, and there's the limbic system, divided into 3 bits. The threat-focused bit, the soothing bit, and the achieving bit. And just like a well-known car, it forms nice 3 perfectly balanced bits there. But sometimes the threat system is overactive, creating emotions of anxiety, fear, and so on. Now remember, the threat system is good. It's on the lookout for us for threats. It's trying to keep us safe, which is a good thing. So we need that threat system there, but it can be overactive. And of course, if it's overactive like that, it has squeezed out the soothing system and the achieving system. They've been all squashed out, and we're all threat focused. We're predominantly threat focused. And that is not really a very nice state of mind to be in. It's an anxious state, isn't it? One of the best ways of shrinking the feeling of threat, obviously, is to boost the feeling of being soothed. It's very much like the RAID course we talked about in the last one in this series, the week before last. If you boost up one element, you displace another element. So rather than focusing on trying to reduce the threat-focused bit of the brain, which is difficult, we can concentrate on boosting the soothing bit. And if that's expanded like that, it pushes aside the threat-focused bit of the brain. Also, maybe it pushes aside the achieving bit, because you're all soothed and content and happy. Why would you go around achieving things? So that works. You can see how that works very neatly, can't you? Same thing would happen, though, if we focused on the achieving bit. That wouldn't be very soothing, would be very driven and so on, but threat-focused would disappear. I don't know whether you must be the same, I guess. I've got a good friend who is very driven. He's very keen to achieve, and he just pushes the threats to one side. He tells me about what he's doing and so on, and makes me anxious. Just to hear his life makes me anxious. Doesn't make him anxious because he's so busy achieving and being driven. And does he want soothing? No, he doesn't. He's too busy. So, but you can see how you can focus on any one of those three bits, and it's normally the threat-focused one you're trying to shrink down a bit. And the best way of doing it is either to focus on the soothing or the achieving.
Are there any illnesses that CFT works better for than others?
Well, mostly it's used with depression and anxiety. That would be the fact of the matter. It's mainly used with depression and anxiety. And I'm just trying to think, well, I wonder if there are other things that it's kind of should be used for, if you like. I bet there's loads of people out there who say, yeah, I've used it for, I can't honestly think of one that would rival depression or anxiety at the moment.
What about BPD?
Borderline personality disorder. Yes, although we've got DBT, which is almost like the intervention of choice for borderline personality disorder. But in a way, I always ask myself, well, when would you not want people to be compassionate towards themselves? And it's very difficult to think of any time you wouldn't want that. The only question you might ask is when you say, well, yes, that's okay, but is there a better intervention? And in borderline personality disorder, we might say, yes, it's DBT probably. But by and large, obviously, we want people to be compassionate towards themselves. So in that sense, it would be an element of intervention right across the board, I think.
Several people are saying that they use eating disorders very successfully.
Oh, for sure. Good one, yeah. Good one.
What do you think about physical health problems?
Yes. Yes. No, I know. It's quite right. People can be very critical of themselves, funny enough, with physical health problems. And sometimes they're actually encouraged to be. They say, well, it's lifestyle. And there's more and more talk, isn't there, about saying, well, this is lifestyle driven and GP should focus more on your lifestyle, which is another way of blaming people for their physical health problems. So absolutely, yes.
I've got a lot of people also using it with trauma.
Oh, very good. Very good. Well, you can see, that threat-focused element, that is what's blown up with post-traumatic stress disorder, isn't it? People are very threat-focused. Yeah, very good. Any of the anxiety disorders, to be fair. Okay. Let's have a look at part 2. This is a very short part. Most people are happy to know that distress is not their fault, more the fault of their tricky brains, but they'd still like to do something about it. So Gilbert talks about the three systems in a way that summarizes it excellently. If we only focus on trying to change the threat system, we may fail to realize that part of the problem is in the balance of the other affect regulation systems, and in particular, the poor output from the soothing system. When that system is developed, the others can settle down. Well, in a sense, that's the words that go with the diagrams that I put together to illustrate it, I think, yeah.
How much compassion is good self-compassion? Because would overdoing it change into self-pity?
Yes, you can imagine there's always a right level, isn't it? You can always go over the top. There's always a best level, and there's too little and too much. Self-pity and really thinking of too much of oneself and being self-centered and so on. Yes, for sure.
And is it harder for people who've had experience of a harsh, critical parent, internally and externally?
It's very topical, that, isn't it? And everything is the fault of our parents, isn't it? So it is a topical thing, but for sure. And this really does go back, and some of it really goes back to Bowlby and attachment and so on, and the model that our parents set for us, and in particular in Bowlby's world, what model the mother sets for us. Yeah. And of course we do, as your question mentions, we do internalize that, and that is the point. We carry that around with us.
Is there an influence of attachment theory in the ability to self-soothe?
Absolutely. Let's have a look at it. Very much so. Gosh, have they read my slides?
It's good, isn't it?
Let's have a look at this. I rather like this little section. Affiliation, warmth, and affection. Love and affection are like vitamins to the brain. Now, we know that affectionate caring associated with feeling wanted and valued has far-reaching and multiple effects on the physiological maturation of the infant. That's Cosolino. So for primates and humans, especially the power of nurturing relationships from a variety of individuals, parents, friends, lovers, to impact on physiology throughout life has become profound. Yeah, so it really affects our physiology. Here's Cosolino again. There's an increasing work showing that how a mother understands and responds to her child's emotions and needs is crucial to the child's ability to understand and regulate their own mind. Now, those who are here and into attachment theory will say, well, that's been around forever. But Cosolino wrote that in 2007. We readily think of stresses as consisting of various unpleasant things that can be done to an organism or a person. Sometimes a stressor can be the failure to provide something to an organism. And the absence of touch is seemingly one of the most marked of developmental stresses that we can suffer. Sapolsky. Yep, and there we are. It is very reminiscent, isn't it, of attachment theory from Bowlby et al. Now, this isn't just a sort of random exercise, Ames. This would be good if people came up with good answers to this. How do we soothe somebody? And there's an invitation to please offer any answers in chat, because I'm not sure there are very brilliant answers. Even whatever you read, won't single anything out, but whatever you read, I'm not sure there are fantastic answers. To answer it, you may consider how a parent soothes a child, which is one of the easier things possibly, how one child soothes another child, how an adult soothes another adult. Now, that's probably the trickiest one, I think. And you might want to reflect on your own experience of being soothed or anything else.
Some lovely ones coming in. A popular one is a hug.
Great.
Talking in a soothing tone, listening, validating, holding hands, acknowledging them, offering a drink or food, validating.
Lovely.
Listening, warm cup of tea. Yeah. They're all pouring in.
That's great, isn't it? That's great. Well, essentially, because I'd got 2 or 3 slides lined up to keep me talking while people were thinking. So let's see if anything else pours in as well. Soothing contrasts with techniques such as problem solving, which is a very good technique, but it hinges on the idea of resolving the problem rather than soothing the person. In soothing, you are explicitly focusing on developing the soothing system of another person, which is a good thing to do, whether or not the problem is resolved. Gilbert and Cozzolino both highlight the neuronal development that occurs as a result of being soothed. And that is really important. I'm not sure whether my slides quite make that clear. The research they cite demonstrates that the soothing actually results in neuronal development, literally the growing of neuronal links and circuits.
I've got a question from Samir. Talking about Cozzolino's view of the role of the mother, would it be a similar role for the father?
Well, this is very peculiar, Amy. I don't know why the emphasis normally goes on to the mother, but that's the way it is. And I'm in great sympathy with your questioner, because I can't see why it shouldn't be the father as well. It seems to me it's the people sort of setting the example, if you like, the parents of or the caregivers, if you like.
Yeah.
So you may also wish to reflect as to your usual preference. Do you normally prefer to soothe the person who's distressed, or to help them sort out the problem, or do you do a balance of the two? If you balance the two, are you happy with the balance you strike? And I guess we all know, don't we? Some people who, are good. If you want a problem sorted out, they will help you. And they'll actually help you do it. They won't just give you ideas, they'll help you do it. Equally, other people will soothe you. They might not actually come and help you sort out your problem, but they'll be very soothing and talk in a warm voice and so on, which is very nice. Which is very nice too. I don't mean to deride it at all. It's both have their parts, don't they?
Is it more important to learn to self-soothe rather than seeking it from others?
I think yes. I suppose if we had to set one against the other, I'd say the answer is yes. And the reason is that the person feels self-sufficient then. It's if you can self-soothe, you know that it doesn't matter where you are, what's happening, you have the resources to look after yourself, as it were. Equally, a lot of people do rely on the soothing and support from other people, and they rely on that quite satisfactorily. They know they can get in touch with this person or that person, and they know they have the resources to seek soothing from other people, which is also good. Okay, there we are. That was my slides to give people space to put in any soothing strategies. Have we got them all, do you think?
Well, they were pouring in. They were coming in quicker than I can read, but a lot of hugging, a lot of validation, a lot of problem solving with them if that's what they require.
Yes.
Nice talking to them.
Yes. It's interesting. I always wary of generalizations, but I do think hugging is very good. But I think it's something that women can do much easier than men. I think men have to be wary to go around hugging people. But I'm probably, probably wrong in that. But there we go.
Rebecca hates hugging, so it's not just you.
Oh, there we go. Well, yes, that's a good point, isn't it? That whatever soothing strategy we adopt, it has to bear in mind the recipient of it. Yeah. Okay. So this is a summary so far, and I'll tell you what, Ames, I thought we might get about this far, and so I put in a summary at this point. And what do you reckon? Have we got time for one more section or not really?
I think so. No, I think we're doing well. We're nice and focused.
Okay, in that case, I'll skip that. Threat and achievement. Some people beat themselves up, and they beat themselves on to greater things. Other people encourage themselves. Which do you think works better? Well, the disappointing answer is they both work quite well, actually. So, but let's have a look at some of the findings associated with this. Dykman talks about growth seekers and validation seekers. Growth seekers enjoy challenges and their ability to learn and mature through challenges and mistakes. Validation seekers feel under constant pressure to prove themselves as likable and acceptable to others. So there are two types of striving corresponding to that. The first is for personal standards. The second is to avoid criticism and rejection from others. So some people, they just want to do things to a particular standard. Even if it's just their hobby, which no one else is ever going to see, they set the standard for that, and they really want to get it up to a particular standard. When I was a child, my brother and I would both make Airfix model kits. And my brother, he just was really particularly made a beautiful things. He made just beautiful models. And that was his style. He wasn't sort of showing off or anything. He just liked to do it like that. I threw mine together and there was glue everywhere and the parts weren't fitting properly, but I was kind of happy with that. So it's personal standards. The second, though, is to avoid criticism and rejection from other people. That's the first is alleged to be a secure form of striving, and the second an insecure one. Well, alleged to be, yeah. So how might you move people along? Gilbert suggests three things. The planning of non-achievement fun things, desensitization to positive affect, positive emotions. There can be a fear of positive emotions, he says, and playfulness. And those are the three things he suggests to move people from the one area to the other, almost like the internal achievement. So let's have a look at an example of this. Which one of these two is better? A person might say, I mustn't drink too much in the evening because I can't afford not to be at my best the next day. There's so much I need to do. Or the same person might say, I don't want to drink too much of an evening because I want to be near my best most days because there's so much I want to do. Not terrifically different, are they? But which do you think of those as more appealing? One or two?
We're getting a lot of twos come in.
Oh, that's good. That's good. That's very nice. Yeah, the disappointing thing is that the people do report a lot of success in driving themselves on, but they don't feel good about it. That's the only thing. But they do have the success associated with it. It's nice, though, if you can drive yourself on to what you're capable of and feel good about it, obviously. Okay. Just trying to remember the one thing, Ames. Yeah, righto. Let's just skim through these as a final thing. Soothing and balancing our emotions. Gilbert suggests 10 things, so let's just skip through them fairly quickly. Affection and kindness from others. Social reinforcing. For example, a person in a group becoming aware that others have the same feelings as they do, but those others are not alarmed or ashamed by them. That's a very nice feeling, isn't it? Being valued by others. You were talking about validation, as several people put down, Ames. This soothes us because we know others will not attack us and will care for us instead. And I think on the next one, we probably have validation specifically. Being heard and understood, especially being validated. Empathic validation, where the therapist understands the person's emotions and validates their experiences. Reasoning or reframing, where the therapist can suggest alternative ways of seeing things. And if the patient can experiment with this, then they may be soothed by that new perspective. Yeah, I'll perhaps give an example of that if we have time. Insight and understanding. If we can understand how our thoughts work, then we're very relieved and soothed, like those three affect regulation systems in competition with each other. This is a very important one, I think. Eliminating rumination. Ruminating activities. Ruminating activates the threat system. So anything that helps us to stop rumination, such as mindfulness, will be terrifically helpful. Now, desensitization, Paul Gilbert talks a lot about this, but it doesn't seem like such a big one to me. I'm obviously not noticed it. The ability to tolerate situations can be soothing so long as the patient feels supported while this is happening. Gilbert maintains that some people are frightened of some positive emotions, for example, affection. So it may be necessary to desensitize those people to affection and positive emotions. And number 10 is another strong one, I think, courage. Because we ask people to face things that are difficult or frightening, courage can be developed if we support and literally encourage, put courage into the person, encourage the person. Okay, so there we are. That is it. But we've got this summary. Here we are. By all means, anybody do say whatever you like. What we covered is this. What is compassion, a CFT? Multi-mind, if you remember, so competing minds. The 3 affect regulation systems, we had a picture of those. Accepting things as they are. You know, it's not our fault that we are the way we are. Adapting to the way we are. Affiliation, warmth and affection. We had a little section on that. Threat and achievement, the different ways of achieving things. And soothing and balancing our emotions. Terrifically important section, I think.
Super.
Okay, that's it.
Okay, well, there's some very sad news coming up, isn't there? Are you ready for the next slide?
Oh, yes. Okay. Is there anything anybody wants to contribute to what we've said?
No, there have been some lovely comments just agreeing and saying how great it is.
Oh, terrific.
Yeah, so no, just lovely things. So
people have had good experience of using CFT, yeah?
Yeah, and very much enjoying what you're saying as well.
Oh, I see. Well, thank you very much.
Yeah, that's nice.
So, do you want to do the next slide?
You all right with have you got the next slide? So, for more information, these are completely free of charge sessions as part of our response to COVID-19 and its variants. Thank you very much for attending, and feel free to catch up on anything you've missed by going to the website, which is at the top, and searching for free webinars, and then invite others to do the same, completely free of charge, and everyone is very, very welcome. But now here's the really sad bit. Well, no, this isn't the sad bit. This is good news.
Not the sad bit, is it?
This is a certificate of attendance will be emailed to you by the end of the week. But this is the last in the series. If COVID makes a return, we will be back. We love it. It's I'm going to miss you all so much. It's not going to be right on a Wednesday. But thank you all so much for all your lovely contributions. And Will, you put so much work in every week, and everyone loves them all. It's just all been so lovely. It's going to be it's not going to be right on a Wednesday. We'll miss you all.
Fantastic. I think actually people come along, Ames, for your nice chairing and the
hardly. But no, we love it. We love every Wednesday. So thanks all for your contribution and your lovely comments. They mean the world when we see them at the end. So thank you.
Lovely. Well, thanks everybody.
See you later. Bye.
See you.